I'm going to examine your abdomen. Do you have any questions about that? Okay, that's good. So before we start, please sign this consent form. Inspect for color, scars, striae, dilated veins, rashes, symmetry, and visible pulsations. Auscultate the abdomen using the diaphragm of the stethoscope. Listen for bowel sounds and note their frequency. Normal sounds consist of clicks and gurgles, occurring at an estimated frequency of 5 to 34 per minute. Auscultate for bruits over the aorta, the iliac arteries, and the femoral arteries. Auscultate over the liver and spleen for friction rubs. Percuss the abdomen lightly in all four quadrants to determine the distribution of tympany or dullness. Tympany usually predominates because of gas in the GI tract, but scattered areas of dullness from fluid and feces are also common. Okay, sir, this time I would like to ask you to breathe through your mouth and relax. For light palpation, keep your hand and forearm on a horizontal plane with fingers together and flat on the abdominal wall. Palpate the abdomen with a light, gentle dipping motion. As you move your hand to different quadrants, raise it just off the skin. For deep palpation, use your two hands and press down in all four quadrants. First, identify the upper border of the liver dullness. Starting at the nipple line, percuss downward in the midclavicular line until lung resonance shifts to liver dullness. You can ask your patient to assist you in the measurement. Then, identify the lower border of dullness in the midclavicular line, starting at a level well below the umbilicus in the right lower quadrant. Percuss upward toward the liver. Place your left hand behind the patient, parallel to, supporting the right 11th and 12th ribs. Press it upward so the examining hand can feel the liver more easily. Then place your right hand on the patient's right abdomen, lateral to the rectus muscle, with your fingertips well below the lower border of liver dullness. Stand to the right of the patient's chest. Place both hands side by side on the right abdomen below the border of liver dullness. Press in with your fingers and up toward the costal margin. Percuss for dullness and the height of the bladder above the symphysis pubis. On palpation, the dome of the distended bladder feels smooth and round. Normally, the bladder is not palpable unless it is distended. Place your right hand behind the patient, below and parallel to the 12th rib, with your fingertips reaching the costovertebral angle. Lift them to displace the kidney. Ask the patient to take a deep breath. At the peak of inspiration, press your left hand firmly and deeply into the left upper quadrant. Try to capture the kidney with your two hands, then ask the patient to breathe out, and then stop breathing briefly. To capture the right kidney, use your left hand to lift up from the back and your right hand to feel deep in the right upper quadrant. Place the ball of one hand in the costovertebral angle and strike it with the ulnar surface of your fist. Use enough force to cause a perceptible but painless jar or thud. May I ask you to cough and tell me where the pain is, okay?
Okay, no.
Ask the patient to cough to see where pain occurs.
No.
Alright. Press deeply and evenly in the left lower there any quadrant. pain? Then quickly withdraw your fingers. Okay. Place your hand just above the patient's right knee and ask the patient to raise that thigh against your hand. Flex the patient's right thigh at the hip with the knee bent and rotate the leg internally at the hip.
Deep breath.
Ask the patient to take a deep breath. Palpate the right upper quadrant with the fingers of your right hand near the costal margin. Here are the following findings. Abdomen protuberant with active bowel sound, soft and non-tender. No palpable masses or hepatosplenomegaly. Liver is 6.5 centimeters in the right midclavicular line. Edge is smooth and palpable 1 centimeters below the right costal margin. No appendicitis nor cholecystitis.